The most common and severe peritoneal dialysis side effects are infection, weight gain, weakening of abdominal muscles. Since you have a port that is open to your abdomen, normally a sterile space, and the blood flow through it is so great, it is a place where bacteria can enter your body and quickly become a problem. As for your abdominal muscles, they become strained and give out from holding the fluid in your abdomen for hours at a time. You may wonder if you are a good candidate for this type of dialysis. When you cannot handle the rapid fluid changes caused by hemodialysis, this may be an option for you. So, it is also a great alternative if you don't want to upset your lifestyle and you are able to care for yourself. When you have scarring in the abdomen or are debilitated, specifically, to the point where you can't take care of yourself effectively, hemodialysis is the way to go. Most importantly, talk to your doctor and see if peritoneal dialysis is appropriate for your kidney function level, overall health and social limits. Access for peritoneal dialysis. Like the access with hemodialysis, a surgeon needs to establish your access for this type of dialysis. It will involve a short surgery, usually same day, and the surgeon will put the small catheter inside your abdomen. You will have a single port with a universal adapter on the end to attach to the dialysate bags for your exchanges. It is important to keep this area and the port scrupulously clean, because any bacteria that get inside your peritoneum will wreak havoc with your system. Be on the lookout for signs of infection, such as chills, fever, redness, swelling, drainage, nausea, vomiting. When you notice that the cuff from the port is pushed out, you need to let your doctor know you are having trouble with your dialysis. When you are manipulating your port, such as taking the cap off, cleaning the cap, or attaching to the dialysate, be sure that you and those around you wear masks to prevent breathing bacteria onto the port. In addition, if you are doing the transfer, you should wear gloves and wash your hands prior to touching the port's dressing. Most importantly, keeping clean and maintaining a sterile environment is absolutely essential to effective, long-term, complication-free peritoneal dialysis. Tips for peritoneal dialysis. Besides wearing a mask and gloves to take care of your exchanges, you can easily work peritoneal dialysis into your life. You can do this type of dialysis in two ways: continuous ambulatory peritoneal dialysis and continuous cycling peritoneal dialysis. With the ambulatory type, you drain in the dialysate and go about your daily life. With cycling, you are hooked up to a machine while you sleep and the machine does the cycling for you. Whatever method you and your doctor choose, it takes less time and inconvenience than hemodialysis. When performing your exchanges, you should make sure you warm the bags of dialysate before allowing them to dwell. If the solution is cold or even room temperature, it can make your stomach cramp from the changes between room temperature and body temperature. Most doctors will also recommend that you change the universal adapter with every exchange to prevent it from harboring bacteria. When you are done with your exchange, you should weigh and record the weight of the discard bag. This is so that you and your doctor can keep track of how much fluid the solution is pulling from your body. Peritoneal dialysis versus hemodialysis. Now that you know a little about each type of dialysis, you might be wondering what the best dialysis is for you. What are the pros and cons when looking at peritoneal dialysis versus hemodialysis? Hemodialysis is a gold standard for all dialysis. It is the best process and the one with the most data behind it. It is actually the dialysis most doctors prefer because the rates of peritoneal dialysis are not high. However, it is intrusive, inconvenient, and sometimes physically demanding. The change in blood pressure can sometimes cause side effects, such as vertigo and passing out, that make this type of dialysis contraindicated. Peritoneal dialysis seems like the star. You can do it on your own time, when you want to, and you don't have to be bothered with going to a dialysis center. However, sometimes it is easy to get lax with your exchanges and become non-compliant. In other words, you feel fine so you just stop doing it. This can lead to dangerous consequences. So if you are not responsible or able to perform the manual tasks on your own, you can end up risking your kidneys and your life. Peritoneal dialysis is also well known for infections, and for some patients, the risk of that is just too great to even try this type of dialysis. Thanks for watching. I sincerely hope my post was useful for you. How to reverse your chronic kidney disease naturally without medicine. Avoid dialysis and kidney